Hi there, my name is Virginia Coulee-Burns. I'm a PhD student in Sociology at the University of Delaware, and I'm also affiliated with the university's Disaster Research Center. My paper is on women's access to reproductive health care during and after disasters. I've decided to research this topic because, despite an increasing focus on disasters and the intersection of gender, not much work has been done on women's access to reproductive health care, specifically women's access to contraception during and after disasters. That's where my research comes in. Even though women's contraceptives do have an objective importance in maintaining reproductive health, there have been policy changes in the United States that run counter to this need, leading some to perceive women's health care as superfluous or morally wrong. And with such a negative perception of women's reproductive health care, how might state-level contraceptive policies and emergency refill laws be constructed in a way that hinders women's ability to maintain an emergency supply of contraceptives and impede their access to contraceptives in disasters? So in my paper, I describe literature that answers this question while simultaneously highlighting the gap in literature on this specific intersection. Additionally, I describe current policies, including insurance policies, and emergency refill laws that answer this question. I then present a discussion and directions for future research to conclude this paper, including the possibility for both qualitative and quantitative research. So the field of gender and disasters is blooming and becoming more and more exhaustive with each passing year. My piece contributes by specifically focusing on women's access to contraceptives during and after disasters. What should happen next is on-the-ground empirical studies. The richest data will likely be found in interviews with women who have begun to settle back into their communities after times of disaster, or perhaps interviews with pharmacists or other clinicians, as they're often the gatekeepers to prescription contraceptives. Also powerful would be quantitative work using state level or national level data to provide a more macro level perspective and picture of women's access to contraceptives during times of disaster. My paper sets the stage and shows the need for such empirical research. Please get in touch by emailing me at vkberndT@udel.edu. I look forward to hearing your thoughts and suggestions. Happy reading!